Professor Chen Hailin, a famous expert in cancer therapy of traditional Chinese medicine, Series 4, drug resistance, easy metastasis, and easy recurrence. Throughout the ages, medical scientists have never stopped researching cancer, but they have never been successful. It is not uncommon for people who study cancer to die from cancer. Western medicine is the mainstream of anti-cancer, but Chinese medicine handed down from the Chinese ancestors should not be underestimated. Therefore, there are many Chinese medicine practitioners who do not care about fame and wealth, and treat low-key people in a low-key manner. And Chinese medicine Professor Chen Hailin is one of them. In recent years, the morbidity and mortality of tumors are on the rise worldwide, and the mortality of malignant tumors has become the first cause of death for residents worldwide. Cancer is a disease that is difficult to treat at the current medical level. The reason is that the cancer does not have any symptoms in the early stages, and most patients are found at an advanced stage. Once many patients suffer from tumors, they feel that, and quote, the sky is falling, and quote, and quote, life is hopeless, and quote. The appearance of Chen Hailin brought hope to the majority of cancer patients. In more than 10 years of medical career, Professor Chen Hailin has always adhered to the road of fighting cancer with traditional Chinese medicine. For thousands of years, Chinese medicine has been closely related to the reproduction of the Chinese nation. It is not only an outstanding advantage of the Chinese nation, but also a treasure of world medical culture. In order to promote the development of traditional Chinese medicine, it demonstrates the dual strength of Chinese culture and technology, and also enhances people and APO's recognition of excellent traditional culture. Feel. And quote, Chinese medicine is the quintessence of the country and the treasure of the Chinese nation. It is a glorious mission and a great responsibility to develop Chinese medicine. It has a good reputation in the eyes of patients. It is the belief in life that it has cured patients all over the country and defeated various cancers. The support and progress of Chen Hailin all the time, no matter how the stages and occasions of life change, this belief is always the same. Over the past 30 years, Chen Hailin has treated thousands of cancer patients, many of whom are poor and cannot see a doctor. Nevertheless, Chen Hailin did not give up on them. Sometimes he preferred to treat poor patients at his own expense. Yang Jia, 70 years old, Chinese nationality from Shaanxi Province. In 2012, the patient always felt that his stomach was uncomfortable, and he always regarded it as indigestion and didn't care about it. After his condition became serious, he was diagnosed with cardiac cancer in September 2012. The patient has always been the mainstay of the family's finances. Getting this news is very important for the family. The bolt from the blue, the family and APO's crops needed him, and the family and APO's financial expenses needed him. The family that was not well-to-do could shame. Chinese only side. He contacted Chen series of $17 the yard of them labor. With tears in his eyes, he said that if he hadn't met Professor Chen, this family collapsed. It took Mr. Yan half a minute to say a few words. The old gentleman looked at Professor Chen Hailin and said firmly that this is the greatest recognition of Professor Chen Hailin and Apo's. Jia Zhuguang, male, 58 years old, Chinese nationality from Shaanxi Province. The patient visited Chen Hailin on June 2, 2018. Main complaint: I was diagnosed with middle esophagus cancer, at the Peace Hospital affiliated to Chengde Medical College on November 17, 2017. Then I went to Beijing 301 Hospital for surgical resection on December 20, 2017. After resection, radiotherapy, chemotherapy, dysphagia, can only take liquid food, acid reflux, vomiting, unable to sleep at night, increased sticky phlegm, weight loss, dry mouth, pale red tongue with sticky coating, tooth marks on both sides. Slow, deep, weak and thready pulse. Thin body, walking difficulty, requires help, low voice, pale yellowish complexion, extremely thin, swallowing liquid food, usually acid regurgitation, vomiting, each meal takes 2 hours, and liquid food. Syndrome differentiation, accumulation of toxins, phlegm and dampness, qi stagnation, and blood stasis. Treatment: dissipating stagnation and reducing swelling, detoxification and dampness, regulating qi and removing blood stasis. From June 2, 2018 to November 2018, with 5 months of clinical of pure Chinese medicine, the original weight of 81 caddies has increased by 125 caddies, the complexion is ruddy and lustrous, the tone is full, and the walking is quick, just like the one who just arrived. In sharp contrast, without interruption, liquid food becomes common food and Apos, feel good about yourself. On February 27, 2019, CT examination was performed at Chengde Peace Hospital, although the lesion has recovered, other organs still have underlying diseases and there is still room for recuperation in 2 or 3 months of the year. 5 years have passed so far, the scene of coming to see a doctor at the beginning is gone. Li Fanghai, male, 68 years old, Chinese nationality from Shaanxi Province. Gastric cancer, gastric angle cancer, poorly differentiated adenocarcinoma. The doctor in the hospital suggested chemotherapy, but because the patient was old and poor in physical medicine cost a lot. As an ordinary farmer, he could not afford such high medical expenses. When I had nowhere to seek medical treatment, I met Professor Chen Hailin under the introduction of relatives. After a series of inquiries, Professor Chen prescribed a prescription for the symptom. The patient began to take traditional Chinese medicine on November 29, 2015. After half a year, his condition was cured. Control. For the past 7 years, he has been in good health. During Chen Hailin and Apo's return visit in 2016, the patient went from being bedridden to now alive and well. Seeing the patient recovering was the greatest compliment to Professor Chen Hailin and the greatest affirmation of Professor Chen Hailin and Apo's decades of TCM research. Qiu Kongli, female, 48 years old. A native of Zhejiang Province, China, in 2018 in the Shanghai Fudan University Cancer Hospital cytopathological diagnosis report, a pathological mass puncture, the report showed, a large number of lymphocytes were seen, and malignant tumors of the lymphoid hematopoietic system cannot be excluded. Introduced by a friend who works in Hangzhou, he came to Dr. Chen's clinic in Luqing, Shaanxi for treatment on September 16, 2018. He was treated with pure Chinese medicine of biphasic therapy with oral administration and external application. After more than 10 months of clinical treatment, the 68 mm mass disappeared and the patient felt good. On October 21, 2019, a fine needle aspiration cytology pathology diagnosis report was obtained in Ningbo Clinical Pathology Diagnosis Center of a tertiary hospital in Ningbo. The diagnosis report showed needle aspiration of left thigh root lymph node. Scattered lymphocytes were seen in the film, but no evidence of tumor was found. After the inspection, the drug was stopped for 3 years and no transfer has been seen so far, and no recurrence has been cleared at one time. Follow-up during the Spring Festival this year. Everything is normal and the health is very good. Dao Chengyi, male, 84 years old, was a professor at the Chengzhou Mechanical and Electrical Institute in Shaanxi Province. The patient was diagnosed with cardiac cancer when he was recuperating, and it was already late Qing dynasty when he was diagnosed. He was admitted to Chengzhou People and Apo's hospital in October 2009 because of cardiac cancer. He was admitted to the Chengzhou City Medical Center for radiotherapy and chemotherapy for more than 20 times. On February 16, 2012, he underwent imaging examination at Hejia Hospital affiliated to Chengzhou Medical College. Opinion, after the radiotherapy and chemotherapy of cardiac cancer, the stenosis is currently blocked. The cancer lesion expands, invades the fundus of the stomach, and the expansion of the gastric body is limited. The doctor once persuaded the patient and Apo's family members to give up treatment. First, the patient was too old and had problems with various physical functions. On the other hand, the patient and Apo's condition was too serious and it would be painful to continue treating the patient. Just when I was at a loss, I heard a visiting family member in the nearby hospital bed say that there was an old Chinese Dr. Chen who was very skilled in medicine. The family contacted Professor Chen Hailin with the attitude of treating a dead horse as a living horse doctor. Professor Chen Hailin has a set of observation, hearing, questioning, diagnosis of illnesses and prescribing of medicines. The patient began to take traditional Chinese medicine on March 12, 2012, and has been completely no metastasis. The old man is 94 years old this year, enjoying his old age in peace. Chen Yinqing, female, 73 years old, lived in Lujiazhuang village, a suburb of Chengzhi City, Shaanxi Province. The patient went to the Peace Hospital affiliated to Chengzhi Medicine in June 1998 and was diagnosed with lung cancer, left lung and APOS, lower lobe peripheral lung cancer, left hilar metastasis. Accompanied by his family, he went to Shaanxi Tumor Hospital for another examination on June 4, and the result was the same as before. Considering that the old man is old and weak, the family decided to use traditional Chinese medicine for treatment. June 10, 1998, the patient went to Professor Chen Hailin Hospital of Traditional Chinese Medicine for treatment. Professor Chen judged the right medicine by understanding the patient and APOS' condition. After 8 consultations, after taking more than 60 pairs of traditional Chinese medicines, the patient felt that his lung disease was basically under effective control. On November 9, 1098, he had a CT re-examination at the Peace Hospital affiliated to Chengzhi Medical College. The results of the examination: 1. The water in the lower lobe of the left lung was found occupying space sexual lesions. 2. A small amount of fluid in the left lung. After taking the medicine, the old man gained a significant weight of 87 kgs that year, and gradually resumed housework. On April 7, 2000, Changzifang People and APOS' Hospital did an X-ray examination, and the report showed left pleural effusion, no obvious signs of lung cancer. Immediately after continuing to take more than 20 pairs of traditional Chinese medicines, the patient and APOS' self-feeling improved significantly. On July 30, 2000, he went to the hospital for an X-examination. Absorption improved. After recovery, the old man and APOS' weight increased to 95 kgs. In mid-April 2003, the old man and APOS' weight gain was 105 kgs, and he returned to normal life and fully recovered. Looking back on the past few decades, Professor Chen Hailin has experienced too much in the difficult years. One-sentence summary: 99 points of sweat, 1 point of inspiration, more than 40 years to achieve leapfrogging. Professor Chen Hailin expanded the space for thinking and imagination from multiple levels, systems, directions, dimensions, and channels. Combine traditional culture and Book of Changes and 5 elements and with Qigong, yin and yang, and self-cultivation. Under the guidance of the theory of multidimensional addition of triple burner gasification in traditional Chinese medicine, it is organically combined with modern medical diagnostic methods and imaging data. Prepare symptomatic drugs, perform gasification, intervene in the gasification center, spleen and stomach in the human body, perform upper and lower gasification mechanism, enter the lesion, quickly curb the proliferation and metastasis of cancer cells, directly kill mutant cancer cells and repair missing mutant cells and cytoplasm, reversing cancer cells into normal physiological cells. theoretical basis, Qian Yuanji Da Lun, says, heaven is gas, earth is shape, and shape and gas are interconnected and transformed into all things. Therefore, the understanding of human physiology and pathophysiology in internal classics is completely from the perspective of transformation of gas come to understand, from the perspective of gasification to study physiological phenomena, pathological phenomena, disease diagnosis, treatment, and treatment. The preventive principle of the human body, through the evolution of gasification, can quickly achieve the goal of eradicating tumors. Using all specimens, a comprehensive cancer treatment plan with unique characteristics and innovative thinking of traditional Chinese medicine has been created.